younger the patient, younger the patient, severe the condition, poorer the prognosis. Fertility practice is actually not an easy practice because apart from medicine, we have to deal with a lot of emotions.
Yes.
And dealing with medical conditions is easy. Dealing with emotions, volatile emotions, is not so easy. One needs a lot of patience to handle couples. Sometimes the cracks in the relationship are quite evident when they come and sit in front of any fertility specialist. It's actually a blame game. Though they are looking for problems, we have to offer them solutions. At the same time, we have to bring their focus from their problems towards their solutions. So it demands a lot of emotional investment, energy investment on the part of the doctor.
Yeah. And to understand them as a human being and not just a client or a patient. And you're doing a remarkable job.
Thank you.
Right. Now, take it forward from here and explain to us about what endometriosis is, how it's treated, what are the causes, symptoms, and everything.
Okay. Endometriosis is one of the common conditions which leads to difficulty in conceiving. Now, for some reason, these days, in my personal practice, up to 40 to 45% of couples with infertility, the woman has some form of endometriosis of some severity. So it is that common now, 40 to 45%. Now, looking at the incidence, this is quite, in many cases, this might not be the only reason for their subfertility. I would rather prefer to use the terminology subfertility rather than stamp them as being infertile. So subfertility, there can be many reasons. These can be female reasons, these can be male reasons. More commonly, these days, we are seeing combined reasons. Combined reasons means the male as well as the female, they both have some issues which compounds the problem. So in the present scenario, as I said, up to almost half cases of infertility, subfertility, have some form of endometriosis. And now, looking at the incidence, this is quite, in many cases, this might not be younger the patient. Younger the patient, severe the condition, poorer the prognosis. Older patients, the endometriosis also affects the uterus per se. To begin with, it starts from the ovary. So what exactly is endometriosis? If you were to ask me this question, our uterus has a lining called endometrium. The terminology endometriosis comes from endometrium, which is the lining of the uterus. Now, our uterus is an organ which is a very, very dynamic organ. The endometrium is the innermost layer of the uterus, which grows and sheds every month. Older patients, the endometriosis also affects the uterus per se. To begin with, it starts...
And hence the bleeding.
Exactly. So the growing phase is something that happens before the ovulation. Once the ovulation happens, the follicle, the former follicle which now has released the egg, becomes something called corpus luteum, which produces progesterone in bulk. This progesterone, along with estrogen, is now responsible for maintenance of the endometrium. Now, this corpus luteum has a fixed lifespan of about roughly 2 weeks. So once this time frame elapses, the corpus luteum undergoes a programmed cell demise. See how beautiful the nature is?
Yes.
Okay. So when the corpus luteum involutes, when it stops functioning, the estrogen and progesterone supply, which had been coming from the ovary, stops. So when this stops, the endometrium is no longer supported with these hormones. So in the absence of these two hormones, the endometrium sheds and the bleeding happens. Now, this time frame elapses. The corpus luteum undergoes a programmed cell demise. If this tissue does not get an outlet to come out, what happens? Because the uterus has a way out, because it is connected to the exterior, it is connected to the outside of the body through the cervical canal and the vagina. So if there is no outlet, this is something that remains accumulated inside the uterus. If this tissue does not get an outlet to come out, endometriosis means the very same tissue, endometrium, is found in an abnormal location. If it is in uterus, it will come out because there is a way. Elsewhere, there is no way to escape. You understand my point, right?
Yes.
So if this tissue is present either on the surface of the ovary or inside the surface of the ovary, the same bleeding, growing, shedding cycle happens wherever this endometrium is present in any ectopic location. Ectopic means maybe a right tissue at the wrong location.
Wow.
Okay.
That's the meaning.
Yeah.
Okay.
So
Wow.
this piece of tissue, which is now at a place in a circumstance where it should not exist, now it is also undergoing the growth phase, and eventually it will shed. So the egress, the debris that comes out remains where it was. There is no place for egress. There is no place for exit. So this debris, this bloody discharge leads to inflammation, local inflammation. Inflammation means it's a tissue reaction which includes damage and repair. Okay, so this tissue reaction makes two adjacent tissues stick to one another. Okay, so the tissues which should have been, in a friendly relationship with each other, each being independent, now are stuck together abnormally.
I see it.
Okay, so this leads to, if it is on the surface of the ovary or inside the substance of ovary, this collection keeps on growing with every period, every menses. So this collection eventually gives rise to something called as endometriotic cyst.
Yes.
Which means, literary meaning becomes a cyst, which is a reaction and a response to endometriosis. Now, in colloquial parlance, this is also called chocolate cyst.
Okay.
Don't stop, don't stop loving chocolate. Why is this called chocolate? The reason being, the discharge inside this cyst, which is nothing but altered blood, it changes color from red to brown, just like the chocolate sauce.
Okay.
So that is why it is called chocolate cyst. Now, these chocolate cysts on the scan, they look very distinct. Okay. When we scan a woman, when we put the ultrasound probe through the vagina, okay, we see the ovaries. Whenever we do the scan vaginally, ovaries are just next to the vagina.
Yes.
Okay, they are located on the side or behind the uterus. So when I put the probe inside the pelvis, such a cyst, okay, it can grow every month because there has been an accumulated discharge which is gradually increasing. Okay, so whenever we see a cyst which looks like this, we always, we try to see whether the ovary is still free or it has started getting stuck to the adjacent tissues. Now, this condition, as I said, can also affect the uterus. It is called adenomyosis. When we scan a woman, when we put the ultrasound probe through the vagina, okay, we see the ovaries. Whenever we do adenomyosis, means the same tissue, endometrium, is now found within the layers of the uterus, which in medical parlance, we call it myometrium. So whatever reaction and response it caused and created inside the substance of the ovary now happens within the wall of the uterus. Now, such a collection makes the uterine muscle thickened. Okay. Uterus is nothing but a muscular bag, the inside lining of which is dynamic. Okay. Adenomyosis means the same tissue, endometrium, is now found within the layers of the uterus.